Thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Tarek Rabah, the president and CEO at Otsuka North America. How are you today?
I'm very good. Thank you so much. I'm very excited to be here. Thank you for hosting me.
I'm very excited to have you here. We're able to make this work, get you on, and I know our audience is really looking forward to learning a little bit about you. So let's start with that. If you could tell us about your background, be much appreciated.
Yeah, thank you so much. So my name is Tarek Rabah, and I am currently president and CEO of the Otsuka North America pharma business. I've joined the company since last April, so it's been about 6 months. But I would always say, fortunate to be in this industry for more than 20 years. As probably you can guess from my accent, I was born and raised in Lebanon, but I've worked all around the world, from Japan until recently in the U.S. in the past 6 years. And I've been really fortunate to be a part of this industry, because I always say that I came into this industry as a coincidence, and I found this role that now is my mission to bring in treatments from the shelves of the research labs, and treatments and solutions to the patients from the research labs or from the innovation labs. To the physicians and to the physician basically offices, right into the patients that actually need this treatment. So I find this extremely fulfilling, and I'm so happy to be part of this industry and specifically Otsuka.
Yeah, it was actually one of the things I was going to ask you to dive more into. So great point for us to kind of dive more into this. It was around, what excites you about this company. So you gave us a little bit. Talk us through in your role and what the company is putting together. What else excites you about being at Otsuka?
So maybe a couple of points just on Otsuka. Otsuka is a Japan-based company. We are a global pharmaceutical company, and our U.S. headquarters is in Princeton and Rockville, Maryland, where I am at this moment. I would say that we have been at the forefront of treating serious mental illness, if you want, since the 1980s. And that is the time we've introduced Abilify with BMS. Unfortunately, today we are only one of the very few pharmaceutical companies that continues to invest heavily in mental health. And I'm so excited about being in Otsuka, because we are developing a diverse portfolio of treatments in pharmaceuticals, whether it's pills or long-acting injectables. We are investing in digital medicine, digital therapeutics, all to treat serious mental illnesses such as depressive disorder, bipolar, and schizophrenia. So I like the fact that at Otsuka we kind of committed to mental health, and we're serving these specific unmet needs. And we are exploring new ways to continue this research, whether it is new areas we haven't been, or look at differentiated mechanism of action to get even more treatment efficacy and more safety to patients.
Let's talk more about you mentioned research. Let's talk a little bit about Otsuka's support of recent research in light of the mental health pandemic. Can you share some of those details with us, and then, what's Otsuka's role in addressing that pandemic?
Yes. Well, thanks so much for this question, because this is really, in a way, the gist of what we're doing and what we are really most proud about. So not only, of course, we look at making sure that we get these treatments and solutions ultimately to patients. I think one thing is really very, very special in Otsuka is that most of our teams are not most of our teams, all of our teams, I would say, are genuinely interested in this area and have um, passion and commitment, and have passed through personal experiences that just increase their commitments to mental health. Recently we have done something that I think is really important in order for us to continue to tackle this mental health, as you call it, pandemic. And we feel absolutely privileged and proud to sponsor a landmark research. It was recently released by an institute called the Satcher Health Leadership Institute, which looks at a 4-year period between 2016 and 2020. That is before the pandemic. And basically, the conclusion is, and I know we talk about it a lot, but the conclusion was that we could have saved more than 100,000 lives and more than 278 billion, to be exact, in resources. So, I know it's a little bit unfortunate to us talk about this, but it's also important to raise awareness around this, and hopefully make sure that we take this, we leverage these findings to do something much better in the future. The report is called "The Economic Burden of Mental Health Equities in the United States," and it's led by Daniel Dawes, who's a nationally recognized leader in the health equity movement. He's also an executive director of the SHLI. It's really one of a kind report that looks at the human and financial cost of mental health equity. So we look at national estimates about the actual burden of mental health care institutes, and what does it mean? What are the implications on policies, on funding access to care and resources? One of the things that we discovered is actually nearly 6 million Americans are not accounted for in national reporting estimates regarding mental health care. So there's quite a lot of it, but what really is important is to understand that we can no longer allow what we call social determinants of health, and I'm talking here about homelessness, lack of access to care and support services, even cultural stigma, unemployment, to contribute to this unacceptable suffering and needless loss of life, especially in the marginalized or the medically underserved populations. So again, I mean, we need to look forward. We are really encouraged by what we're seeing with some of the work that the Congress, some of the important policymakers are doing to reform the mental healthcare system. And of course, more importantly, placing equity at the forefront of this policy change to bring the parity and exclusivity we absolutely need. So, I mean, Otsuka is absolutely committed. We are committed as a team to continue to be some kind of a bridge builder, to bring together, let me call it a coalition, to address some of these issues, and hopefully be able to transform the healthcare system into a more patient-centric one, really serving patients where they need and when they need it in their own communities. It's a very long story, but it's a very passionate one. We're happy that this report is going to help us at least to understand the cost of not using these findings and making some actions in the future.
And my last thing, Tariq, for you as we kind of wrap up here, and thank you for that response. Really appreciate it. What's next for the company? What are you really looking forward to as we go into Q4 of 2022? 2022. I said that right. It's weird.
Yes.
And it's kind of wild that we're almost heading into 2023. So kind of talk us Q4, what you're excited about, and then beyond, again, what you're able to share.
Yeah, so the beauty about this industry is that it's a very long-term industry, and if you really want to invest in healthcare and invest in innovation, you need to take decisions and be very consistent and I would say persistent in them. So we look forward to continue investing in our mental health portfolio and to continue to invest in the future in some areas where these areas are not where there is still significant unmet needs, such as PTSD and some other and some other areas in that perspective.
Well, Tarek, I really appreciate you coming on the podcast. Um, I definitely want to have you come back on again. We'll probably meet up at some of these in-person conferences too. We can do a live session. But congratulations once again on this awesome opportunity to lead this great company. And I wish you all the best of luck.
Thank you so much. Thank you for your time. Appreciate it, Jared.